welcome to the Deep Dive. So, we've heard from you, our listeners, and it sounds like there's a real interest in getting a better handle on agency staffing rates. Why are they sometimes higher?
That's right. It's a common question.
Yeah, and our mission today is really to, unpack that. We want to look beyond just the hourly number and understand the whole picture. What goes into these agency partnerships? Things like market realities, the value they actually bring.
Exactly. And how it all adds up. Because when you first see a higher hourly rate, well, the immediate thought is cost, really.
Cobra. Yeah.
But what's interesting is how those rates often reflect some basic economic ideas, plus, the huge range of services agencies actually provide. It's about seeing that bigger picture, the value story.
Okay, great. Let's dive right into those market dynamics then. Our sources point out that agency rates are really tied to what's happening, like right now, in staffing. Supply and demand. Can you break that down a bit?
Absolutely. Think of it as market responsiveness. So when there's a sudden need for certain professionals, maybe nurses during a bad flu season or a shortage somewhere specific,
Right.
agency rates tend to go up. This speed, this responsiveness is actually crucial. It means facilities can still get the people they desperately need exactly when they need them, avoids being critically short-staffed.
Ah, okay. So unlike permanent staff.
Well, yeah. With permanent staff, compensation is usually looked at, maybe once a year? It takes much longer for their pay to catch up to those immediate market shifts.
So agency rates are almost like a real-time stock ticker for staffing demand.
That's a good way to put it, yeah. And that brings us to something called efficient price discovery. Agency folks, they often work in lots of different places, sometimes across different regions even.
So they see more.
They see a lot more. They get a much better feel for the going rates. They're just more aware of their actual market value,
That makes total sense. If you only work in one hospital, you might have no idea what someone with your exact skills is earning just like 10 miles away.
Exactly right. Permanent staff might not have that broad view, and sometimes, they might be earning less than the current market rate without realizing it. That transparency in the agency world helps make sure pay reflects the real value of skills now.
Okay. Now, another term that popped up was the flexibility premium. What's that all about?
Right, the flexibility premium. Essentially, it's the extra bit agency professionals often get paid because of the trade-offs involved in agency work.
Trade-offs like?
Well, think about it. Often less job security, maybe really varied schedules, different kinds of benefits packages compared to permanent roles. That higher hourly rate, it's partly compensation for embracing that kind of flexibility.
So it's a give and take. They get paid more for being adaptable, and facilities get that ability to adjust staffing on the fly.
Precisely. It works for both sides, really. Facilities get the agility to scale up or down, which is huge these days. And the professionals. They're fairly compensated for working in a way that's maybe a bit less predictable.
Gotcha. Now, you also mentioned rates varying by region. How do agencies juggle that, operating in different markets?
Yeah, that's a really important point about how agencies work. They often cover a much bigger geographic footprint than just one single hospital or clinic system, right?
Sure.
So their rate structures, they have to kind of average things out across these different regional markets. Cost of living varies, demand for skills varies. It's quite different place to place.
So a rate might seem high locally.
It might. But it could be what's necessary for the agency to attract good people across their entire operating area, making sure they can actually fill jobs wherever they pop up. It's definitely a balancing act.
Okay, so we've got the market forces driving the rates. But the sources also stressed, look, it's not just about the cost per hour. There's this comprehensive value proposition. Let's explore that.
Yes, absolutely vital. Got to look beyond the rate. Think about all the services and benefits wrapped up in that agency fee. A big piece is the administrative infrastructure.
Okay, administrative infrastructure. What does that actually mean? What's included?
We're talking about all the stuff happening behind the scenes, The systems, the processes needed to find, vet, and provide staff who are qualified and compliant. Like their recruitment systems, how they find people. Then there's verifying all the credentials, doing proper background checks, monitoring compliance ongoing. These are complicated, expensive things to run well, needs real expertise.
Right, not simple stuff.
Not at all. And the key thing is, agencies spread these costs over tons of clients. They get economies of scale. It means you, the facility, don't have to build and run all that yourself. You're tapping into a shared specialized service.
So instead of every single clinic building its own huge HR and compliance machine, they leverage the agency's existing one.
Exactly. And that flows right into quality assurance. Agencies have set ways of screening people, checking their skills, doing reference checks, even monitoring how they perform on assignment.
So they're kind of guaranteeing a certain standard.
They're minimizing the risk, yeah. The risk of hiring someone who isn't right or doesn't meet the necessary standards, which, has big implications for patient care, for meeting regulations. It's a layer of vetting.
Okay, that makes sense. And then you mentioned risk management benefits. That sounds important, but maybe less obvious.
It often is less obvious, but it's significant value. Agencies usually take on the responsibility for things like workers' comp claims if someone gets hurt on the job.
Oh, wow.
Yeah, unemployment claims, other potential employment liabilities, they often handle that.
So they're basically absorbing financial risks that would otherwise land on the facility's doorstep.
Exactly. Plus, they manage scheduling risks. If an agency person calls out sick, the agency usually scrambles to find a replacement quickly. That transfer of risk. It can provide real peace of mind and, frankly, financial protection.
And I imagine service responsiveness is huge, especially when things get crazy. Nights, weekends, short notice.
Oh, absolutely critical. Being able to find qualified people fast, especially during those off hours or holidays, is a massive advantage. Agencies have the networks, the infrastructure to react quickly.
Preventing gaps in care.
Preventing gaps, preventing disruptions, avoiding potential regulatory headaches. That responsiveness really proves its worth when you're suddenly facing a shortage and need help, like now.
Okay, it's definitely becoming clear. That higher rate isn't just for the person showing up. It's for this whole support system. The vetting, the compliance, the risk coverage, the speed.
Exactly. It's the whole package.
So how does this fit into the total cost picture when we look beyond that initial hourly figure?
Right. This is where we need to get a bit more nuanced. Because when you hire someone directly, there are loads of direct employment costs way beyond their base salary.
Okay, like what?
Well, you've got mandatory stuff. Social Security, Medicare taxes the employer pays, unemployment insurance, workers' comp premiums.
The required stuff.
The required stuff. Then add optional benefits. Health insurance contributions, maybe retirement plan matching, paid time off vacation, sick days, maybe tuition help. All these things add a hefty percentage on top of the base wage for every single hour that person works. The sticker price of a perm hire, it really underestimates the true cost.
Right. Those are the costs we sometimes forget when just comparing an agency rate to a salary number.
They're easy to overlook. And then think about the hidden costs of vacancy and recruitment.
Hidden costs?
Yeah, like the overtime you might pay existing staff to cover shifts when a position is open, the potential hit to quality, or just the extra stress on the team.
Burnout.
Definitely. Plus, the actual costs of recruiting. Posting ads, screening resumes, doing interviews, checking references, then onboarding and training the new person. It all adds up.
Yeah.
Vacancies aren't just empty slots. They cost real money.
And using an agency can sidestep a lot of those vacancy and recruitment costs for the facility.
It really can. Which leads us to the administrative burden. Just managing payroll, benefits admin, tracking time off, doing performance reviews, keeping up with compliance for all your permanent staff. It takes a lot of internal resources.
HR team is busy.
Very busy. Agencies handle a huge chunk of that admin for their own staff. So it lifts that burden off your internal teams, frees them up. You're essentially tapping into their HR department, saving you that overhead.
That makes a lot of sense.
Yeah.
Less admin work internally saves time and money.
And one last point on cost. Staffing efficiency differences. Permanent jobs often have some, let's say, buffer capacity built in, right, to handle ups and downs. But that can mean you're paying for downtime during slower periods.
Underutilized time.
Potentially, yeah. Agency staffing, though, can be matched much more precisely to your actual needs, your patient census. You scale up when busy, scale down when it's quiet. That efficiency paying only for staff when you truly need them can often help offset the difference in the hourly rates themselves.
So paying for exactly the coverage needed, right when it's needed, instead of carrying a fixed staff level all the time.
That's a big part of the total cost calculation. Now, okay, moving past just the dollars and cents, our sources also bring up some really interesting strategic considerations, things beyond pure economics.
All right, let's explore those strategic angles. What benefits are we talking about beyond the bottom line?
Well, one of the biggest is flexibility capability. We touched on it with cost, but strategically being able to quickly ramp staffing up or down. maybe patient numbers surge, or you start a new program, or something unexpected happens.
It's like a pandemic.
Exactly. That ability gives you operational resilience. It makes you much more nimble, more adaptable in what's, let's face it, a pretty dynamic healthcare world.
So agility to react quickly. Got it.
Mm-hmm. Another key strategic plus is specialized expertise access. Agencies often have networks of people with really specific high-level skills that might be hard or just not cost-effective for one facility to hire permanently, especially if you only need that skill sometimes.
So you can bring in, say, a specialist for a short-term project without a long-term hiring commitment.
Precisely. You tap into a talent pool you might not otherwise reach, and then there's something maybe less thought about. Innovation exposure.
Innovation? How so?
Well, agency professionals, because they work in different places, they see different ways of doing things, they see different technologies, different care approaches. They can bring those fresh perspectives and ideas into your facility.
Huh. That's fascinating. So agency staff could almost be like bees, cross-pollinating best practices between organizations. I hadn't really thought of that angle.
It can happen. They see what works well elsewhere. And finally, some agencies are getting into workforce development partnerships, meaning they might offer pathways for temporary staff to become permanent hires eventually, or they run training programs, things that help with the bigger, longer-term workforce picture, not just filling today's gap.
Interesting. So it can be more than just transactional. Okay, so for facilities using agencies or thinking about it, what practical tips did the sources offer for making these relationships more cost-effective?
Yeah, good question. How do you optimize it? The sources had a few ideas. One is strategic volume commitments.
Giving them more business?
Basically, yeah. If you can offer an agency a more predictable amount of work, they can plan better. That often leads to better rates for you and maybe even preferred access when things get tight. It builds a stronger partnership.
Makes sense. Predictability usually helps with pricing.
It does. Another one, advanced scheduling. Whenever you possibly can, give the agency notice.
Don't wait till the last minute.
Exactly. Last minute, urgent requests almost always cost more. Planning ahead lets them optimize things, find the right fit without the rush, potentially lowering those premium costs.
It definitely sounds logical.
Yeah.
Anything else?
Yes. Instead of constantly jumping between agencies just to chase the absolute lowest rate for every single shift, think about consistent relationship development.
Sticking with a few key partners.
Right. Building solid relationships with maybe one or two selected agencies. Over time, they really get to know you, your facility's culture, your specific needs, your patient population. That leads to better matches, better service. It's valuing the partnership over maybe saving a tiny amount short term.
So investing in the relationship pays off long term.
Often, yes. And finally, set up good feedback mechanisms. Talk to your agency partners, tell them what's working, who did a great job, but also provide constructive feedback if things weren't quite right.
Two-way communication.
Exactly. It helps them continuously improve the quality of the professionals they send and how they serve you. It optimizes the whole thing.
Okay. So as we wrap this up, it's really clear that agency staffing costs. Well, it's complicated, isn't it? It's way more than just comparing one hourly rate to another.
That's really the core message for you, our listeners. Whether you're using agencies now or just thinking about it, that rate difference, it reflects market dynamics, yes, but also this whole package of value, the infrastructure, the quality checks, the risk mitigation, plus the strategic upsides like flexibility and access to skills.
And really understanding all those pieces lets you make much smarter, more informed decisions about your staffing mix. You can better appreciate what a good agency partner actually brings to the table.
Absolutely. Look beyond the initial number. Consider the total value, the strategic fit.
So maybe the final thought for everyone listening is this. How could a strategic blend of permanent staffs and agency staff create the most resilient, most adaptable workforce for your specific situation? Moving beyond just focusing on that first hourly rate you see. Thanks for joining us for this deep dive.